going to focus on trauma, which is when an individual is overwhelmed by an experience such that they feel that a threat to their life or their sanity has taken place. The experience is so traumatic that it negatively affects how the person acts in the rest of their lives. With us today to help us discuss trauma are two people who had experience with it firsthand. Phyllis Lorenz is a marriage and family therapist. She has extensive training and experience in working with trauma. She has worked in various agencies, serving at-risk families, and also has a private practice in Berkeley. Welcome, Phyllis. Also with us is Barb S. She is a person who has experienced trauma and is a recovering trauma survivor. Welcome, Barb.
Thank you.
I thought we'd start by talking about what the experience of trauma is to a person. Barb, can you tell us your story in your own words, like what were your experiences growing up and when did you have a traumatic experience, that kind of thing?
Sure. I was raised by my parents who were married for 35 years, and I have, until my dad passed in 1978. And then I have 4 siblings, twin brothers who are older, an older sister, and a younger sister. And so in our family, my mom was a verbal abuser, and she was a very angry person, a lot of control issues. And some of the abuse that I experienced while growing up as a child into my early teens were things. My mom was very abusive verbally. She would say very mean things to me. She would hit, slap, throw things. On the other hand, my dad never responded to anger. He used the flight technique, and I'll explain that a little bit later on. And he would simply not respond. He would go wash the car, go clean the garage, go mow the lawn. He just removed himself from the situation. Okay, so then at age 16, I got married and had my first son. At age 18, I had my second son. And my ex-husband was an alcoholic. And living with an alcoholic, I experienced a lot of abuse as well. And the different areas of abuse that I experienced with him were emotional, sexual, physical. And the physical abuse that I endured was slapping, hitting, kicking, strangulation. He also used weapons. He used a gun and a knife. And there were also times where I was threatened, and I'll give an example of the threatened part. So he put me in the car, and he took me up this dark, windy road up into the mountains, and he pulled the car up to the edge of the mountain and threatened to take the car over the edge. And it didn't happen, fortunately, and I survived that. And then I want to really tell how it impacts your life going forward if you don't address the trauma. And so an example of that, fast forward X amount of years, I'm now divorced, I'm dating a person, and we're together in a car. And he's telling me he wants to take me over to his friend's house. And I said, okay. And he starts going down a dark, windy road, and I'm in unfamiliar territory. So that experience that I had several years back came front forward, and I really started panicking on the inside. I thought he was going to take me to a place where he was going to hurt me. And then when he pulled up in front of the house, I was released. I knew I was safe. But
it's sort of like that fear remains with you, and it will crop up and something else reminds you of that situation.
Absolutely.
Yeah.
It's as if it were just yesterday. And so you just relate it to the event that's happening at the moment. And then I got divorced from him at age 21, and I was a single mom with 2 boys. And then a few years later, I think I was around 26, 27, I was struggling being a single mom, so I decided to go back with him. And that was a big mistake. The abuse started all over again. And so it got to the point where my sons and I, we had to escape. So our escape was crawling through the bedroom window when he was passed out from being drunk and just getting to safety. And so that's what we did. And didn't go back with him again, just stayed away. And then my life at that time, when you talked about insanity earlier, I was living insanity. It was pure chaos, doing the best that I could. And what I learned is I was a victim, and my dad was a victim. My mom was the abuser. You don't tend to think of women being abusers, but my mom was the abuser. My dad was the victim. So I had a role model to follow. I became the victim. I learned that role very, very well. And stayed in that role for quite some time.
When did you decide to seek help?
Well, I was in and out of therapy throughout the years. Once I divorced my husband, but it was for what I call crisis management. Whatever was the crisis at the moment, I was in therapy for short spurts of time. And no one ever addressed trauma. One therapist told me that I had been tortured, but we never did anything about that. There was no recovery around that, if you will.
So a therapist didn't know how to treat trauma.
Exactly.
It was sort of a standard therapist, but not a trauma specialist.
Not a specialist.
Yeah.
And so they did talk therapy back and forth.
Right.
And then about 3 years ago, I was having a very difficult time at work. I couldn't focus. I was missing deadlines. I was missing my commitments. I was crying on the drop of a dime at work. And my world was just caving in. I was starting to have flashbacks of the physical violence from my ex-husband. Everything was coming to a bubble for me. And so at our employer, we have a program called Employee Assistance Program, EAP. And so I called them and asked for a referral. And I was expecting, just get another therapist. And the person on the other end of the phone said, Barb, we have a lot of different specialists in therapists. I said, like what? So she went down the list. And then she said domestic violence. I said, that's who I want to see. And that led me to my therapist 3 years ago.
Okay.
And so in therapy for the past 3 years. But my initial take, when I went to go see my therapist, pretty much I was just crying. Just a lot of crying going on. And then she had to get me to a point where I was stable, because I was such a mess and could barely function. And as I continued to see her, she realized that I needed some additional type of therapy. It was bigger than just seeing her specialty.
We'll go back to that story, but I want to ask Phyllis about, could you tell us sort of what trauma is and whether Barb's experience is typical or atypical of people with trauma?
Yes, I'd say it's very typical. Trauma really is an emotional response to an upsetting or terrible event. And the event could be an accident, it could be coming back from war, which we all agree is traumatic. It could be witnessing violence. It could be growing up in an alcoholic home. It could be growing up with divorce. There are lots of things. Trauma is actually pretty wide. And in order to understand trauma, I think it may not be the time to do this, but it's important to understand the brain. And so, but left untreated, like Barbara was saying, there are serious consequences to untreated trauma.
How is the trauma stored in the brain and the body?
Okay, Good, thank you. Well, I like to think about the brain as and how it develops, and it is stored differently in the brain. The brain is very complex, and in the last 20 years or so, we've really learned a lot about the brain. But what we know is that initially there are three basic parts of the brain. For simplicity, let's just think of it that way. When a baby is born, the only thing the baby has is the brainstem, because this controls all life functions. It also happens to store survival responses. From birth, the limbic system starts recording everything that happens, positive and negative. And we're wired for survival as human beings and mammals. And in order to survive, we want to approach the things that are positive, and we want to avoid the things that are negative. So the limbic system is busy recording, okay, I don't want to go to that again. And the amygdala sends a warning shot when there's something familiar and sends it to the brainstem, we have to do something. And so in the second year of life, the frontal cortex begins to develop, and this is the executive function of the brain. And it can override the warnings of the amygdala if it isn't a real emergency. But in Barbara's case, driving in the car to her boyfriend's friend's house, her limbic system said, this feels familiar, this feels like that horrible time on the edge of a cliff, and we have to do something. So the amygdala sends a message to the brainstem, panic, we have to panic, we have to do something, let's get out of here. And so when that happened, she lost her frontal cortex and was just in emergency mode. But once she figured out that we're safe, and we're at this friend's house, like you said, her frontal cortex came back and she was able to then calm down.
It's sort of like the response is a threat to their life almost.
Yes.
And they react in that way.
Absolutely. Depending on the age, a threat to a 2-year-old is going to feel very different to an adult. So a barking dog to a 2-year-old could feel like life-threatening, or mother not showing up, and neglect can feel life-threatening.
With different kinds of trauma, do these people with different symptoms, or is trauma pretty much the same depending on what kind of trauma it is?
Well, it really does vary on the individual.
Okay, so individually.
Yeah, that depends on the age. As I said, a 2-year-old will experience things as traumatic that an adult wouldn't. It depends on the basic temperament and vulnerability of the person. And it depends on the kind of support systems that are there. It also depends on previous traumatic experiences and what the history is, so that if there's a discrete, now something really big happens, depending on what has gone before, you're predisposed to developing something like PTSD.
Can you tell us what disassociation is?
Well, dissociation is it's a number of things, and we can think of it along a continuum, because everybody dissociates at some point. I dissociated yesterday when I wasn't paying attention to the traffic because I was listening to the radio, and I thought, I'm almost home. How did that happen? So that was, everybody does that, from time to time. And then there's really adaptive dissociation, where your doctor is performing surgery and you want them to pay attention only to your appendix. You don't want them thinking about what's for dinner, because your appendix is very important. And so that's an adaptive form of dissociation. So you can think of it as a narrowing of focus where everything else is blocked out. But then when it comes to trauma, it's a narrowing of focus in a way that it compartmentalizes information. So it's a way of storing information in the brain so that you don't have to think about it all the time. Because, for example, a young child may have, when you were growing up in a pretty chaotic home, you still had to go to school and learn how to read. And so to think about the trauma going on at home all the time wouldn't have been very useful, and you wouldn't have been able to learn. And sometimes it does impact kids where it affects their ability to learn. But for the most part, dissociation is a way of storing information so that it doesn't disrupt the going on with life.
So it can go anywhere from daydreaming to what?
Well, the other extreme of the continuum would be what used to be called multiple personality disorder. It's now called dissociative identity disorder, where there are distinct personalities that take on different functions and to sort of take over for a person.
So Barb, how did you receive a diagnosis? Was it the first time you?
3 years ago when
3 years ago.
3 years ago when I went to my current therapist. She had told me that I needed some intense therapy, and the insurance that I had only covered X amount of sessions per year. I don't remember what the amount was. That's insignificant. But what she realized is I needed weekly treatment. So I was diagnosed with PTSD. And I mean, I understood what it meant, but I wasn't quite sure how it related to me at the time. It really didn't matter to me. I was just in so much pain. I needed to get some help, and I needed help right now. And then further down the line, what came with that was depression.
And to realize the extent of what you've been through.
Right, and the depression part, that diagnosis bothered me the most between the two, because that was, I perceive that as a label. People are going to think I'm sick. I need to go on medication. I'm not normal, if you will, that type of thing. And people don't understand. If you've never lived it, it's hard to understand it.
Phyllis, do you do diagnoses, or is Barb's experience typical of what one might see with trauma survivors?
Well, I do diagnoses primarily for the insurance companies, as she said, because they like to know that they're actually treating, something is being treated. They like to have that label. But when I see clients, what I really see is I'm looking for the symptoms that they bring in to the room. And because the symptoms tell the story more than the story tells the story. And one thing about trauma is, and the way trauma is stored in the brain, is that telling the story of the trauma is actually re-traumatizing, because trauma is stored in the right side of the brain, and it's nonverbal and it's in a sensory way, held in the body. So I'm looking for the symptoms, and the symptoms really are a person's valiant attempts to control their nervous system, because trauma can send a person into hyperarousal, because these are survival strategies. For example, fight or flight, is up here in hyperarousal, and this would be panic and impulsivity, increased heart rate. You're really preparing all your muscles to fight or flight. The other end is hypoarousal, and this would be submit, I give up. Depression would fall down here. So Barbara's really kind of going between hyper and hypoarousal. And what's important in therapy, as I see it, is to really help people learn to regulate, because the nervous systems are completely dysregulated, and they have a difficult time staying within this optimal arousal zone. So everything that I like to do in therapy is to first of all, get the frontal cortex back and help the person begin to be able to regulate their nervous system, which has gone haywire. But it's the way they learn to survive.
What kind of therapist should you look for to treat trauma?
Well, I think it's important to look for a therapist who understands trauma, understands how trauma impacts the brain, who understands dissociation, because if people have had trauma, they have probably the ability to dissociate, because that's what helps them survive. Depending on the degree, they dissociate more or less.
You talked a little bit about the therapies that you underwent. What did you find most helpful? Which therapies did you find most helpful to yourself?
There were other types of therapies that it was recommended for me to seek. Shortly after I started seeing my therapist, I joined a 12-step program. And I'm still in that today. And I have a sponsor that I work with on that. And I also was referred to a psychiatrist, and she's the one who prescribed the medication for me for my depression and to aid me to sleep, because I was having a lot of difficulty sleeping. And then My therapist also referred me to a woman who used techniques of Rosen method and somatic experiencing. And so I did that as well.
What's somatic experiencing?
It's really being in tune with where you're feeling a particular feeling. I don't know if I'm quite saying that right, in your body.
Oh, okay.
If you're feeling anger, where is it affecting your body right now? Is it in your stomach? Is it in your back? Is it in your chest?
Right.
So really get in tune with your body. You asked me about what was the most helpful.
Yeah.
So I would have to say my therapist. And the reason is because she, as a specialist, which I am so grateful for, she realized it was more than just therapy sessions that I needed. She's the one who introduced me into all these other areas of treatment.
So can you tell us what kind of therapies are typically used to help people with trauma?
Yes, according to Bessel van der Kolk, who runs the trauma center in Boston, he promotes something called EMDR, which is eye movement desensitization and reprocessing, and that's a very effective trauma treatment for discrete trauma, for a car accident, or when there's extensive trauma, he recommends somatic therapies. I'm trained in sensory motor psychotherapy, which is Pat Ogden's. She developed that, which is a body-oriented therapy. Again, working it through. One thing about sensory motor psychotherapy is that it really does blend the thoughts, feelings, and sensations. Let's see. He also recommends yoga, tai chi kinds of things because it's a movement, mindfulness kind of thing. A mindful movement, I should say. I offer a group at the agency where I work, Family Paths, here in Oakland, that is called Finding Peace Within, and it teaches skills, somatic skills for people who are struggling that are survivors of trauma.
Barb, since you started this journey, what has changed for you? How does it affect your life today?
A lot of things that have changed for me. One, I'm able to set boundaries for me, which is really, really important. I didn't have any boundaries before, so I would just accept any type of behavior, really. I'm able to recognize my triggers, and I've learned how to respond to those triggers differently than I had in the past. Learning to communicate how I feel, that is huge, and I'm just learning how to do that. Rather than suppressing everything or, smoothing things over, saying, everything's fine, I've gained strength, courage, and hope, and spirituality through all the therapies that I've gone through. A big piece for me was I was able to have compassion and forgiveness towards my mom, because early on in therapy I was really angry at her, and I was able to come to peace with her, and she just passed this past November. So that was huge for me on many different levels, for her and for me. I knew she was at peace as well, so it was a wonderful thing. Recovery is ongoing. I've mentioned I've been in recovery for 3 years now, but it's become a lifestyle for me.
Okay. So. Well, thank you.
You're welcome.
I think what I'd like to do is to talk to those of you who are watching this show and ask you whether you know of someone who has experienced trauma. Maybe it's you, maybe it's someone else. If so, I'd like you to think of what you've learned in the show, that trauma can occur in many circumstances and affect your life in many ways, and that there are effective therapies to help you deal with it. And then I want you to decide what you're going to do now that you have this knowledge. Back to your assignment. Now what I'd like to do is to leave you with some resources. First, there's a group that Phyllis mentioned, a trauma support group called Finding Peace Within. It is a program of the Family Path Agency. And for information, you can call the 24-hour support line. It's on your screen, 510-893-5444. It is a 10-week group meeting, and it meets once a week in Oakland. There are a couple of websites that you might find helpful. There's one by Dr. David Baldwin. It's called Trauma Information Pages. It gives comprehensive information and resources on trauma. Secondly, the Department of Veteran Affairs has a special PTSD website that has just for veterans and PTSD. I'd like to thank you, Barb, and thank you, Phyllis, for being guests on the show. And I'll leave you with these words from the Reverend Dwayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage. For deep down, there is another truth. You are not alone. Thank you for watching, and we'll see you next time.